Come in.
Hello, Earl.
How's it going?
I'm Nurse Caller. I'm going to be taking care of you.
All right.
I think it's time for some medication for your pain and your pneumonia. Are you in any pain right now?
No. I'm doing pretty. I don't know. I'm like probably a 6 out of 10, so maybe some would help, yeah.
Okay, I'll get that right up for you. Let me just go get your medications ready.
All right.
Okay. Actually, quick, could you tell me your name and date of birth?
My name is Earl Johnson, born December 12th, 1938.
Okay, and are you allergic to any medications or anything?
Not that I'm aware of.
And that matches your risk round. Awesome. All right, I'll get your medications pulled up for you. Okay, so he has an order for morphine sulfate. That's Earl Johnson, 12/10/1938. That matches the orders on the MAR. Perfect. The route is IV push. The dose is 2 milligrams per milliliter. The dose is 2 milligrams, and the amount is 2 milligrams per milliliter. So he'll get 1 milliliter of morphine. And the time is now. He hasn't had it in the last 3 hours, and he needs it for pain. And the reason is pain. I'll document after I do it. So let me quickly draw this up. So I gotta take the top off. There we go. I'm gonna rub this for 15 seconds. And that was 15 seconds. So while I'm waiting for that to dry, I'll get my 5 milliliter syringe ready with a needle. Drop 1 milliliter of air, uncap, and then I will start going in there. Awesome. I'm gonna drop all of the medication out of the vial. So I drove all the medication out of the vial. I'm gonna toss that. And then I'm gonna call on my fellow nurse to verify that I have wasted what's left. So I'm gonna waste everything except for 1 milliliter. Hold on, let me get the air out first. Okay, I'm gonna waste everything except 1 milliliter. You verify that that's 1 mil?
Correct. Looking good.
Awesome. Okay. I'm gonna quickly recap that. Okay, more things recapped, and then I'm gonna dilute that into 5 milliliters of normal saline. This is normal saline, so I'm gonna uncap this. I will waste half of this because this is 10. I'll drop some air. Then I will insert the morphine. Morphine has been inserted. Then I'm gonna get all the air out of here. Good, okay, now I'm gonna recap it. Morphine has been drawn up. Okay, then I'm going to write a label. Earl Johnson. Medication is morphine. The bottle said June of 2025, so it's not expired. So 625. Concentration is 2 milligrams per milliliter. Also, I'm going to label is morphine. Okay, the morphine is ready. Next thing I'm going to do is I'm going to get his cephalosporin ready. So he verified his name and date of birth and his allergies. He's not allergic to this medication. The bag's intact. It's not discolored, and it's not expired. It says 12/20/30, so it's not expired. The medication is cephalosporin, 1 gram per 50 milliliters. That's the right amount as per here. The route is IV piggyback. Dose is 1 gram. and the time is now. He has not had it today, and it's 10 o'clock. And the reason is antibiotics for his pneumonia, so that's great. All right, and then I'm just gonna get the line ready. So let me close the line off. And then I'm gonna spike the bag. Awesome. I'm just gonna squeeze this a little bit. Great. And then I'm gonna get it primed so that when I go in there to give him his meds, it's all ready to go. Okay, medication is primed. Awesome. Last thing I need to do is label the tubing. So let me get the label done. Awesome. Great. Now label the tubing real quick. Now Earl is ready for his meds. Okay. I'm going to enter the patient's room and administer. So let me begin.
Come in.
Hello, Earl. I'm back with your medications. Let me quickly get some gloves on. So you've had morphine before, correct?
I have a long time ago, but yeah, I have.
Okay, just a reminder, it can make you a little dizzy and a little tired feeling. So if you have to get up to go to the bathroom or anything like that, please call for help and we'll come right away to help you, okay? Because we don't want any falls. Does that sound good?
Yep.
Okay. So I'm going to be giving that now for your pain, okay?
Okay.
Just going to do one last check to make sure everything's right. So, you are Earl Johnson, correct?
Correct.
And what was your birth date?
December 12th,
Yeah.
1938.
Okay, and you're not allergic to any meds?
Nope, not that I know of.
Okay, that's what your wristband says. So, and it's 2 milligrams in this milliliter, and it's diluted. This is morphine. The time is now. The route is IV push, and the reason is pain. And I'll document this when I'm done. Perfect. Okay. Let me quickly clean this port of your IV. I'm going to clean this for 15 seconds. Then I'm going to get ready to push the morphine. Okay, so the morphine is going to get pushed over 5 minutes very slowly. But before I push it, I'm going to double check the IV site is clean and the bandage is clean. There's no phlebitis, no occlusions. Have you had any pain with your IV site, sir?
No, it's been feeling fine.
Okay, and then I'm going to push the morphine over 5 minutes very slowly. Okay, so it's been 5 minutes. I'm going to then just flush with some normal saline to ensure that if all the medication gets in there. Between vials, I want to make sure to clean the port one more time for 15 seconds. Awesome. I'm just quickly going to flush the site. Very slowly. Thank you, sir.
No problem.
And then I will let me go again. Unpause. Great. The next thing I'm going to do is I'm going to hang my piggyback and give the antibiotics. I'm gonna do one last check. So he's told me his name and his date of birth. It matches up for Earl Johnson, and the drug is cefotraxone. The route is IV. The dose is the dose is 1 gram per 50 mils, and the time is now. He hasn't had it today. The reason is for pneumonia and antibiotic, and I will document when I'm finished. So let me quickly hang this. Pause the infusion, and then I will lower down the main normal saline. Great. And then kind of clean the most distal part above the pump with some alcohol for 15 seconds. So I'm cleaning the port. Okay, the line's already been primed, so I'm just going to remove the cap. Insert it into the port. And then I'm going to allow it to go down. The pump is paused, so that won't go anywhere. And then I will program the pump. So what I need to do is select secondary. Okay, the rate is going to be 100 mils per hour. Total volume is 50 milliliters. And then I will just hit start. And then I make sure that both medications are compatible with the current IV fluid before I came in with the with Epic. And then, all right, sir, so if you need anything, please call me. If you notice that you have a little bit of itchiness or rash or trouble breathing, get a hold of me right away, okay?
All right.
Thank you. I'll be right back in 30 minutes to make sure everything infused.
Okay.
And then I see that the IV is dripping. Perfect. Let me quickly document what I did. So I'm going to initial that yes, I did give this medication at 10 o'clock. Same with the morphine I gave at 10 o'clock. These are my initials. My signature is Calder, IFT, Linfield, Good Samaritan student, school nursing student nurse. Thanks.